and it's our pleasure to have you with us this evening. Today, we're going to talk about dental health, and it will be presented by none other than our prestigious Dr. Ihab William Atie. For the benefits of those who did not know yet who is Dr. Ihab William, let me give you a brief background. Dr. Ihab William Atie is from Lebanon, and he is a general dentist by profession. And also he is a root canal specialist. He graduated from Lebanese University and has already more than 20 years of experience in this field. He opened his own clinic in Lebanon, then traveled in 2006 for the first time as a tourist in the UAE. In 2008, he got his first job offer in Dubai. Many prestigious dental centers in Dubai use his experience to enhance their treatment, especially the root canal treatment using dental microscope. In 2011, he opened his own clinic in Dubai, and in 2018, he started to work as a root canal specialist in Abu Dhabi and in many clinics. Dr. Ihab William Atie has a long experience as well as in cosmetic and veneers. So I would just like to give a briefing to all at the same time that this is a recorded video, and at the same time you can raise your questions and anything that you wanted to know about at the end of the presentation. So please help me welcome to sorry for that. So now please help me welcome our presenter, Dr. Ihab William Atie. Over to you, Dr. William.
Hello, everyone, and welcome to this meeting, presentation, and thank you for the lovely introduction message. You did a lovely job, actually, as usual. Hello, everyone. It's nice to have you here today with us. We will go directly through our presentation, okay? Today, we will talk a little bit about our health, and especially the health of our teeth, which are important. Let me share the screen with you. So today I will go to talk about dental health overview, everything what we know about teeth. I will speak very simple words to get to your mind and to be a simple presentation for you as well. Will not go deep like doctors. So the food we are taking, we need the two nutrients for our body, and the food is the most important thing to take and to process in our body. So the first step of the food is to be swollen and well chewed. So when the food will be chewed very well, we need very important to have all the full denture and our full teeth to be there. If we have missing teeth, we are missing on chewing our food very well. So if there is any problem, all the digestive system will be affected and our health will not take the nutrient from our food. So for what is relative to our teeth, the smile, the teeth are for showing a smile, of course, and these anterior teeth are for cutting food, okay? And then we have the posterior teeth. The posterior teeth are for showing the food very well. So if you have an open chewing, biting like this, we are not chewing well our food, so we will have a problem. That's why orthodontics and braces are important for every person who doesn't bite very well. Okay, not only for cosmetic, we are talking also medically speaking, okay? So it's very important to have all our teeth, no missing teeth, no extracted teeth, and a very well bite to chew our food very well, and to be ready to be swallowed and to be going to the digestive system where all the organs will be absorb all the nutrients from our food. Otherwise, I have few patients who has some medicine, taking some medicine just only because they don't have enough teeth and they swallow and they don't chew much their food and they have problem in their organs, so they take some medicine for that. So we don't need to arrive to that period, okay? Let's talk a little bit about tooth anatomy. So the tooth, it has a crown and a root. The part of the crown is what we see in our mouth, but the most important also, there's the roots. The roots are not shown in our mouth, of course, but this is the infrastructure of our teeth. The root, the crown is composed from different layers. The first layer is the enamel. The enamel has a lot of calcification, a lot of calcium inside. It's a protective layer. It doesn't have innervation. There's no nerve inside. So anything we eat, we don't feel it, even cold or hot. But if we can see, there is another layer here. It's called dentin. The dentin, it's the thicker layer of the tooth, and it has innervation. So that's why it's a little bit more sensitive than the enamel, and it has less calcium. The third layer is the pulp cavity. The pulp cavity has innervation, the nerves of our tooth, plus the blood supply. And plus we have the roots where there is a canal, and inside the canal there is the blood supply and the nerves. So all these are innervation, nerves, plus blood supply. So, and this tooth and these roots, they are in the bone. Okay, and they are linked together through a suspension system here, where we can eat very easily, and we don't feel much difficulty. So let's go into this is a real tooth actually, where the doctor, he removed a tooth and he let it dry, okay, and he clean it, of course, disinfect it. And this is a real enamel, okay, and this is a real dentin. And this is where it's supposed to be in the nerve and the blood supply. Okay, and this is some decay here. You can see here some darkness. This is a real tooth extracted. Okay, so the tooth decays. What's a decay? A decay, it's a destruction of the tooth structure. It's coming from the bacteria of our mouth, and plus the sugar we are taking with our food. So the bacteria plus sugar, it will give us an acidity in our mouth. So this acidity, it will give us destruction of the enamel, the first layer. So this stage is a decay in enamel. These stages are not painful usually, because we said there is no innervation in the enamel. So this is the advanced decay. So already the decay is here, is deeper, but we don't feel anything yet. So the third step, it's a decay in the dentin. So the dentin, we said, it's innervated. It has some nerves. So that's why if we feel pain in our tooth, that's mean we are in a late stage. It's not the first stage. So it's very important for you to go to the dentist every 6 months, even if you don't have any pain. This stage will give you pain on cold and hot things you eat, and even on sugar things, sweet things. So the pain will come and go, and when you take the cold and hot, you will feel the pain. And this stage is the last stage. This is a stage, is very painful, where the decay already has reached the pulp cavity, where the innervation are there, the nerve is there. That means the nerve is inflamed, you feel more pain, you cannot sleep, you feel pulsative pain, you feel continuous pain, and very hard, very painful pain, okay? So you don't need to go to this stage. You need just to go to your dentist every 6 months, everything will be just fine. You know, prevention is better than treatment. So why to go to this stage and to pay more and to feel pain more? So prevention is better than treatment. Okay, so what's the prevention? As you do every day, there is a toothpaste, there is a toothbrush, there is a dental floss, there is a mouth rinse. The toothpaste and the toothbrush, of course, they are cleaning your teeth, but we need to clean our gum also, because the gum, if it's inflamed and it's not cleaned well, it will inflame. On a later stage, I will show you the technique, how to brush and clean our teeth and our gum in other meetings. The dental floss is here to help us to clean between our teeth, because the toothbrush itself, it cannot clean all the parts of the tooth. And we have also the mouth rinse. So the mouth rinse is here to disinfect what we cleaned already. So with we take a little bit of the mouthwash and we rinse for 30 seconds at least. And we don't eat or drink anything during 1 hour to give its full effects. Okay, if we reach already, if the decay reach the enamel or the dentin, we can do a filling. We can remove the dentist will remove the decay and a filling can be done. But if the decay is very deep, here we have to do an intervention which is called root canal treatments. So what is a root canal treatment? It's a removing of the decay, opening a small opening inside the tooth, going into the canals, okay, of the roots, cleaning, shaping, disinfecting all these canals with our special instruments, and then closing them with a special obturation inside the canal. And then we'll put a filling here, and then we can put a post just to make it stronger, the tooth, because any bite, a hard bite, strong bite, can still break this tooth. So what we need to do, is to clean very well the canals, close very well the canals, put a post, it will give a strength, then put a crown. The crown here is to protect our teeth from any fracture, because the root canal will make little bit weak our teeth. Here we see that we have a tooth with a crown already, with a root canal treatment already done, but this infection came back. For example, after 6 months of our treatment, we still feel some pain on biting, some swelling, some pain. So this kind of symptom, we need to check again our doctor. It can be that some bacteria came back or some bacteria multiplied, and it's affecting our bone, affecting the surrounding here. That's why when you bite here on the crown, you have some pain. So that's why this is the role of a root canal specialist, which is me, to arrive to this abscess and to clean it, disinfect it very well. So my job here is to remove the crown, remove this post, remove the obturation, the fillings of the root canal, and to clean, disinfect this abscess, and then to close again the canals, and to put a post again, and to follow up a little bit, just to check if my patient has still a symptom or no. After many weeks, if everything is okay, my patient is feeling fine, no symptom, no swelling, no pain on biting, that's mean the case is fine. And then we put the crown, and of course, always I check with my patient during 6 months with different x-rays if everything is okay. So here, as a specialist, I am using the dental microscope, which is giving me, this is the dental microscope here, and I can see a bigger size, bigger picture of my tooth, okay? And I can see even the canals here, and there is an obturation here, which I was removing under the microscope. So the root canal is done under microscope, which is very important for us as specialists. The veneer, let's talk about a little bit cosmetics. The veneers are a very thin layer of ceramic that we cover our teeth, and we can change the shape and the color of our teeth. So we take impression, we send to the lab, and the lab will give us a thin layer like that, which will put on our teeth, and it will change the smile. It will enhance the smile, and we can do Hollywood smile or any color we want, just to be natural also. Here, there is a big damage of a tooth, which we cannot do other than a crown. So what is a crown? In that case, we need to shape our tooth in that shape approximately. Shape that tooth approximately, and then put the crown in its place, and there is a contact, very well contact between the teeth. The braces can be metallic, it can be ceramic, and it takes 6 months to 2 years usually to have a good treatment for aligning our teeth. And there is another treatment for braces, which is the aligners, clear aligners. Also, this is another treatment to align our teeth. Also, our children need a special attention. You can go for a pedodontist, which is a children root canal specialist. We can start to visit your dentist from 6 months age of the child. A little bit about wisdom tooth impaction. Not every wisdom tooth need to be extracted. Not everybody has wisdom teeth in their mouth to be removed. So when you have any symptom like pain, swelling, you have some smell in the mouth, that means maybe your wisdom tooth is not coming straight forward. So here we need an intervention from our dentist. Implant or bridge after extraction. We have an implant. We can do an implant, an abutment, this one, and then a crown on it. And another choice, another option, which is a bridge. A bridge is connecting two teeth to each other. There is 3 crowns here. So we remove a little bit from this tooth, a little bit from that tooth, and we take impression, we send to the lab, and the lab will give us a bridge. Of course, which one is better? Of course, the implant, because it doesn't damage the 2 teeth, which could be healthy. So an implant is a small surgery we do here. After 3 to 6 months, the doctor will open a little bit here, the gum, and then we'll put an abutment here, we'll put the crown here, and everything will be just fine. There's no accumulation of food underneath. I just wanted to show you a case which I did. This is a full case. The patient grind on his teeth is a bruxist, and he brushed very hard. So in that way, we need to grind the teeth and under anesthesia, of course, make an impression upper lower, send to the lab, and the lab will give us nice crowns. We choose this color, not too much white, not too much dark, and because we need to give a kind of natural smile. So this is the right side of the patient, this is the anterior side, and this is the left side of the patient, and this is the final result. I hope this fast presentation is giving you some motivation to take care about your teeth. I think if you have any question, I'm ready to answer any question. Back to you, Sej. Your microphone is muted.
Thank you very much for that great presentation, Dr. Ihab. And it really gave us enlightenment that the teeth is not only for smiling, but it plays an important role in our digestive system. So I believe that everybody here gets an overview what is the importance of teeth and how we should take care of it, and what is the importance of visiting our dentist every now and then. Because for me, myself, I don't go to the dentist that much, but now having this knowledge, I am aware that I need to visit my dentist at least twice a year. So I believe I have some question here, doctor. I'd like to address this question to you, as sent to me. It says here, I need crowns to do, but I am afraid that they will make smell and gum inflammation. What can you say about it? Dr. William, I think you're muted.
Crowns are important to be made, especially if the decay is very, very important to be done. So the filling is okay if the decay is small, but if the decay is big, like we saw in the slide, the crown is very important. So actually the smell is coming from if the dentist is not preparing very well the tooth, is not taking a very well good impression, the lab is not doing a proper job, the crown is not fitted well, there is a lot of factors that accumulate. And then if we put the crown in its place and it's bigger than the tooth itself, this is the most factor that will accumulate food between the crown and the gum, and it will give some smell. Actually, I have a question here, which is there is one patient has already a bad smell in her mouth, but she doesn't know why. She take care of her tooth very well and she clean. So I can advise this patient that you need to go to your dentist every 6 months to have a checkup, a dental x-rays and cleaning. The dentist can clean your teeth in different way than you clean it with your toothbrush. And there is a special technique to clean your teeth and your gum. The dentist can help you with that technique. And then you can mouth rinse, and you can maybe you need to visit your dentist, especially you can, if you clean and you don't feel there is a result, that's me, maybe the tartar is already there. So you cannot clean it with your own toothbrush. You need to go to the dentist, and he will take care about your gum. He will give you all the advices you need. Maybe you have some crowns defective. Maybe you have some filling. There is a lot of factors that can affect a bad breath in your mouth. A lot of factors, actually. Your microphone is muted.
Yeah, I have one more question here. What is the advantage of the microscope for me as a patient? Do you grind the teeth when you do veneers for Hollywood Smile? Your microphone.
Grinding the teeth, we do a little bit grinding, okay, because if I don't grind the teeth, absolutely we will have accumulation of the tooth of the food between the veneer and the tooth, which will affect and will give an inflammation of the gum, an infection. So that's why we do a little bit grinding of the teeth, just to have a proper fitting of our veneer, to come and to have a healthy fitting, and then like a tooth it will be, not something like it has an edge or accumulation of a food. I have a question here also. How much time it will take from the decay to develop from one stage to another? Thank you for this nice question. Actually, it's depend if your tooth is deciduous or permanent. I mean, for the teeth of children is different from the teeth of adults. So the decay is developing in the teeth of children much more faster. That's why we need to take care about the teeth of our children. In the adult teeth, it can take 6 months to 1 year to develop and to reach the nerve. And for the children, it's a couple of months only. So that's why you need to go to dentist and check every 6 months to check if there is any decay there and in which stage it is, because you don't know, because you don't feel it until it's too late.
All right. Thank you very much for that information. I have another question here. Every root canal treatment needs a root canal specialist. Is it? Or you cannot just go to any other dentist?
Some cases are very easy to do, like the anterior teeth, they have only one canal or one canal. The premolars are here. So the premolars, they have one canal or two canals. This can be done from any dentist. But if you have a molar, which is a big tooth, and it has 3 canals, 4 canals, so you need to go to a root canal specialist. I have another question here. Is there any age which can assume that the wisdom tooth doesn't need to be removed? I say also, if you don't have any pain, yes. So not every time we have a wisdom tooth, we need to remove. Not every wisdom tooth need to be removed. This is decided by the dentist, the surgeon, and by the patient, of course. If we have pain, if we have swelling, if we have food compaction, accumulation of food between the teeth, between the wisdom tooth and the molar nearby, this is not a good sign. This tooth need to be removed. Okay, so if the wisdom tooth it's in its place and everything is okay, no symptom, no pain, nothing, no need to remove any tooth. This is just an additional tooth, and it's helping you to chew better. So instead of having 2 molars, you have 3 molars, which is fine. So that's it. Any other questions, Hedge, from your side? Miss Hedge.
Yeah, I get another question here.
Yeah.
Can I delay what brand and type of toothpaste and toothbrush do you recommend?
Okay, any toothpaste, any toothbrush can be good. Okay, the most important is to know the specific technique which your dentist can teach you. The most important also to bear in mind that you need to clean your teeth and your gum. And actually, between your teeth, I will show you something here. I will share again the screen. Where is it? Okay, here, share it again. Okay, so here, when we go, we have a tooth and the gum. So here we have a small pocket. This small pocket need to be cleaned by your toothbrush. Okay, so bear in mind, have in mind that you need not only to clean your tooth, you need to clean your gum and your pocket here. That's why you need to put your toothbrush not horizontal, not vertical, of course, but inclined like this, 45 degree. You put it 45 degree, you make little bit vibration and then rotation up, vibration little bit and rotation up. This is the best technique I can advise you to clean not only your teeth, but your gum also.
I see. All right, doctor, I think our time is about to finish, and
How much
we
time you
promised
still
everyone. We have 30 minutes, and now it's 8:30.
This
We
is
started
addition,
at 8
no?
o'clock. Yeah.
Yeah.
Now we
Yeah.
have additional, but I think
I
Maya
think,
has a question
yes,
here. Mm-hmm.
she
Do you
can
think you
send
can?
a message if she wants, or she wants to talk by video.
She can.
You want to talk
I
by
think she
video,
can.
Maya, or you want to send it by, or you want to talk by microphone?
Yes, I can talk.
Yeah.
Hi, how are you?
Hello, hello, Maya. Welcome.
Yes, thank you. So if the nerve is being removed for about, let's say, 4 to 5 months, is it okay to put the crown, or there is more procedures that has to be done before the crown?
4 to 5 months without option, without any symptom like pain on biting, any swelling, any smell, anything, any fistula like a small pimple which is coming from the gum near your tooth. If no symptom like that, you don't have anything from that, we are ready for a crown. We are most ready for a crown.
Yeah, so it's a simple procedure, just put the crown. Do you have any idea how much this would cost?
About the price, we can discuss it later, but there is a range always. It's depend on the crowns and these kind of things.
Okay, we'll see you soon then.
Most welcome, most welcome.
Thank you.
Welcome.
Have a great night.
You too.
Bye.
Thank you. You have
Thank
other
you.
question, I think, Ms. Hedge?
Yeah, I have one here. How I know if a dentist is a root canal specialist?
Okay, you can ask the clinic. They can show you in Dubai. They can show you a DHA license, the Dubai Healthcare Authority. They have a license to show for every doctor. Usually they put it on the wall, on a wall in the clinic, okay, or anywhere that any patient can see it clearly. And it's written root canal specialist, not only root canal specialist. We say root canal specialist for you, but the term, the medical term is endodontist, okay? Or yeah, endodontist. That's why I put in my presentation endodontics or endodontist, but this is a root canal specialist. Yes.
All right.
Endo, that's mean inside the tooth. Exo is outside.
I see.
Yeah.
So there's another one here. Is root canal treatment painful?
Yeah. More you delay your treatment, especially if you have pain, more it will become painful. Okay. And more the treatment will be painful, and your anesthesia will not be effective. Okay. So always bear in mind, have in mind that don't delay your treatments. More you delay, more the anesthesia will not be effective, and more the treatment will be painful. But we do our best for you not to have a discomfortable treatment as much as possible.
All right, that's a good news. So there's another question that is sent to me. It says here, I am afraid to brush my teeth because they are bleeding and painful. What should I do?
Bleeding from the gums is something not normal, okay? But you don't need to be afraid, because when you brush them to clean them, it will come some blood, and this is kind of normal because you are cleaning something. It's coming out, the blood, etc. So I motivate everybody to continue to brush and to clean his teeth, even there is a blood. Okay, but he needs to go to a dentist and to check what's going on, what's the cause, the problem, where is the problem, and the dentist, he can find out what is going on, where is wrong, what's wrong. It could be a technique, wrong technique. It could be a crown, it's accumulating food, a wrong filling, wisdom tooth in the wrong direction. So always go to your dentist. Don't be afraid. Go early.
Thank you very much, Dr. Ihab William, for this. And I believe that our time now is, we have 6 minutes overdue now because of the technical error. However, next topic, we will do it again. And I believe some people here in our, some participants here would like to hear next topic. So everybody is welcome to send a message. What is the next topic that you would like us to discuss about? It could be a root canal treatment, deeper, because this is only an overview of what we have discussed this evening. It could be a deeper discussion about orthodontics, implants, dental cosmetics, and other specialty like psychotherapy, gynecology, ENT, and anything related to medical, which you are interested. Let us know. And Dr. William, how can we reach you?
I'm easily reached by, maybe some people knows me already, by mobile number or by WhatsApp, or we can share my email, so I'm not far away. I will type my email if anybody wants to ask later any question. I'm ready to answer it.
Yeah. Great. All right. So thank you very much for this evening. And it's our pleasure to have our participants who are able to join us this evening. And hopefully next time they can also invite their friends and spread the good news. And, you know, it's a very informative session. And I hope that next time we'll see you again. And Dr. Really excited to have the topic.
Welcome.
I think Ghassan, yeah, I think Ghassan would like to say something. He raised his hand, or?
That's not a question. I'm just clapping my hands for this presentation. Thank you, Dr. Ihab. Thank you, Raj. It was nice and informative.
Thank you, Hassan.
Great.
Thank you.
Yeah. Okay.
Thank you for your questions. It was nice questions.
Is there anything else that we missed here for this topic this evening? Welcome.
I would like to add something, Saj,
Mhm.
that some people are asking me sometimes, if I'm traveling, can I delay my root canal or something like that if I have pain? My answer is always do the root canal, at least the first step, okay? Because what is pain? Why is coming the pain? The pain is like inflammation of the nerve inside the pulp chamber, as we said. And this is coming in the pressure. Why the tooth? It's a most painful pain because this cavity here, it's closed, and the nerve will be inflamed, and there's no way to be swollen. No tooth can be swollen because it's a hard tissue. That's why it's a more unbearable pain. Okay. When you have pain, you just go to your dentist. You don't travel, because traveling, there is a difference of pressure in the plane that can affect, and this difference will affect you badly, really, for your pain, and you cannot do anything. Even the painkiller cannot help you much. So go always to your dentist, check what's going on. If you can do at least the first step of a root canal to open this cavity, this closed cavity, and to release the pressure, this is what you can do and help yourself. Then you can go and travel, and then you come back, and then he can continue the treatment for you.
I see. All right.
Yeah, I think we covered everything tonight, and thank you for being here, everyone. Hope to see you soon.
All right. Thank you very much, Dr. Ihab.
Thank you for
And
the invitation.
inshallah, next time.
Okay.
Have a
Good
great
night,
evening
everyone.
to all. Good night, and have a great evening to everyone. It's a pleasure to have you with us. Thank you. Thank you very much. Thank you for you, Dr. Ihab. Thank you.
Thank you for you too. Bye-bye.
Thank you.